Joining us in our newsroom is Dr. Michael Weiner, research scientist at the Regenstrief Institute. Welcome.
Thank you. Good to be here.
A new study came out saying that the coronavirus hospitalizations are due to four diseases. What are these conditions and why is this happening? I mean, 64% of people hospitalized with these four conditions. So tell us.
Sure. This was a study out of New York City, and it did show a link between age, heart failure, cancer, and being overweight with those conditions and dying, and in some cases also with being admitted to the hospital or having critical illness. I should clarify that the study is a study of associations or links between these factors and death, and they're not necessarily directly causal, although they may have a role in contributing to those outcomes.
Right, there's so many other factors that goes into this. I mean, right, like you mentioned, there's gender, there's race, there's lifestyle activities, or there's other things that can always contribute. So we can't make a causation here, but this correlation is pretty strong. These diseases, the hypertension or the high blood pressure, diabetes, heart failure, obesity, they're preventable. So what can we do if we either prevent this disease or we find ourselves that we do have these diseases? What can we do to then prevent us from getting the coronavirus, but then also if we do get infected, prevent having to go into the hospital?
Well, absolutely. And although the studies don't prove that these individual conditions have caused the problem, they likely contribute to it. And it's quite possible that taking steps to prevent or lessen the burden of some of those comorbidities may actually improve outcomes in the long run. And so doing things like controlling weight, like we always want to do, and getting that body mass index down may prove to have beneficial effects and lower risk for some of these terrible outcomes. Similarly, other lifestyle factors, including conditions that may contribute to heart disease with diet and physical activity, may ultimately be helpful. And finding ways to lower blood pressure, for example, whether those involve medications or lifestyle factors. Smoking is another big factor that is associated with some of those other conditions. And although we're not entirely sure what the relationship between smoking and COVID outcomes is, there's some suggestion that there may be a link there too.
Well, those are some great tips, Dr. Weiner. And so I'm just wondering, did the study take into account that these people may have had more than one of these conditions? Because a lot of times if we have high blood pressure, we might also have heart disease or a different kind of heart disease, let's say, or maybe we're obese. So can you speak to that?
Absolutely. Many patients and other people with these comorbidities have more than one. Often they do go hand in hand. For example, age is linked with cancer, and body mass index is linked with diabetes, and so on. The studies do often have ways to adjust for those links to look at independent risk of each factor individually. And when we do that, we still see independent associations between these factors and outcomes such as death or critical illness. And again, those factors are primarily age over 75, presence of cardiovascular disease, cancer, and extreme body mass index, especially over 40.
And turning back to just the four diseases that we had spoken about, does this surprise you, these numbers? I mean, 30% are obesity and 28% high blood pressure, diabetes. Does this surprise you?
It doesn't surprise me. We know in the US and even throughout much of the world, the prevalence of these conditions is very high. Diabetes is very common. Obesity is even more common. And conditions such as cardiovascular disease, of course, of other types, are very common. So we expect to see some of these links. And we know that those conditions are associated with other types of adverse outcomes aside from COVID-19. To expect that these conditions will contribute to immunocompromised states and strain on the cardiovascular system and impaired healing related to infections, that's very much expected, unfortunately, I would say.
Well, speaking about compromised immune systems, this just got me thinking, Dr. Weiner, in terms of vaccinations. And I was wondering, these individuals are already, in a sense, they're sick and have a compromised immune system related to these diseases. Is there any reason to think that they might not respond as well to this vaccination?
Well, it is possible. And we might expect people who have a less robust immune system, such as an older person or someone with some of these medical conditions, to have a lesser immune response to the vaccine. But of course, that doesn't mean they shouldn't get it. If anything, it means they should get it because they need some extra help in activating their immune systems. So I think if anything, studies like this help confirm that we should continue to take aggressive measures at prevention, which would include vaccination for many populations, as well as the things we have been doing, such as isolation and masking.
Right, right. It's not time to let up just yet. And you are a proponent of the vaccine. You're a scientist. The science supports this. Can we just speak to your perspective on these vaccines?
Sure. I'm a physician. I provide primary care to patients. I also direct a research center. And there's lots of evidence that the vaccine can really help to lessen the burden of illness. And also plenty of evidence that it looks to be very safe right now. So I think that should really send a very strong signal to everyone in the public that they should really strongly consider getting vaccinated when they have the opportunity, at the earliest opportunity to do so.
When it comes your turn, get in line. Okay. And just last thing, I want to just circle back to the vaccination and whether or not the people with these four diseases may or may not have a more robust response or a lesser robust response to this vaccination. And I know we don't know yet. There's not the science to support it. But then it makes me think about also reinfection. We don't know how these vaccines are going to work in the long term. And I'm just wondering, any thoughts on whether these individuals might also be at risk for reinfection post-vaccination?
Yes, it's a great question. And yes, we can expect some risk of reinfection at some point. Would it happen within a month or a few months, or more like a year later? It's too early to tell. We know from other types of viruses that vaccines are not a guarantee, although they lower the risk substantially, and that infection at a future time is certainly a possibility, and that we may be in a situation where revaccination is actually warranted. When and how, those are questions to be answered. But I think it's quite possible and likely, and we need to learn more and study more about that.
Dr. Weiner, thank you so much for being here. Really appreciate it.
Thank you very much. Stay safe.
You too.